let's talk about headaches in old people. So the old people, they tend to have very fragile, weak blood supply and blood vessels. Okay, so they tend to have some immediate bleeding if they kind of fall, and old people tend to fall a lot. Sometimes if they fall, and it's not a kind of a major fall, kind of a trivial fall. They might hit their head, and they just get up and they just forget about that injury. But what happens is, in old people, sometimes this injury could potentially result into formation of a blood clot in their brain, okay, which they don't immediately does not give any presentation or any kind of complaints. But gradually, these old people, they tend to complain that they're having kind of a vague kind of headache for a very long time. And also, if it gets worse, the patient may even, these old people can even show some signs of confusion. They will be like confused sometimes, and all of a sudden they are normal. They will like mimic like some of the other mental conditions. But truly, it is very important for these people to come to the hospital and get them checked. Most likely, a doctor will do a CT scan of his head, and at that point we will come to know about the problem, which is usually some accumulation of blood clot. And if it is too big blood clot, then a doctor may consider consulting a neurosurgeon to evacuate that blood clot. If it is small, then we can manage it medically. Well, that was about the old patients. Now let's talk about the kids. What happens is sometimes, kids are quite slippery, you can say. Kids tend to fall off due to a lot of reasons, while walking, while playing, whatever it is. Sometimes I've seen many patients, like the mother bring their kid and say that he fell from the sofa, from the height of a sofa, or from the table. Now it's very important to know if it is the floor on which the baby fell is a carpeted or a wooden floor. If it is a hard wooden floor, then there are chances that the baby must have incurred some kind of injury in the head. So in that case, and also the baby sometimes not immediately, but after few hours, baby may be like not active. They may not drink, they may not feed properly, or they may not be active at all. Like usually the kids are like moving their hands, yelling, crying, whatever, but they may not be doing anything. They will be like very, very lazy, kind of closing their eyes, not opening too much, and drowsy, dizzy. So in that case, definitely you should bring your kid to the emergency. Potentially they might be having some brain injury. Okay, so that was about elderly and the kids with